Now to a health issue that the armed forces say they're taking very seriously, and it's all to do with sex. New figures show an alarming rise in the numbers of sexually transmitted infections among the 15 to 24-year-olds in the UK. In 2009, there were almost 483,000 cases, compared with almost 471,000 in 2008. That's a rise of 12,000 new cases. Half of all men diagnosed and two-thirds of the women were all under 25. Well, let's talk to our health expert, Dr Rob Hicks. Rob, why are these? What are we talking about? What kind of infections?
Well, we're talking about chlamydia, gonorrhea, genital herpes. These are the infections that have shown an increase in the number of cases diagnosed. Good news is that for genital warts and syphilis, the number of cases has slightly reduced with the latest figures, so that's sort of reassuring.
In the cases where it's on the rise, why is that?
Well, I think when you talk about chlamydia, I mean, there's a greater awareness of chlamydia now amongst the general public. There's certainly the National Chlamydia Screening Programme. And I think overall, the stigma attached to coming to a sexual health clinic is less, so people are more confident to come and get tested. The downside is we're seeing youngsters in particular who are somewhat blasé about not practicing safer sex, relying on the fact that they know treatment is available. So that may also contribute to why more cases are being diagnosed.
As I said earlier, the armed forces say they're taking this very seriously. They even have their own sexual health working group. What have they said about this?
Well, we spoke earlier to its chairman, Colonel David Ross, and he said that because of the nature of the work that servicemen and women do, you might expect them to be risk takers. But in reality, that's not necessarily the case. The other thing is that they've been making great progress in tackling the problem of STIs and indeed raising awareness.
In 3 units, a Phase 1 recruit training unit, an infantry unit and a Phase 2 unit, I think it was, we sort of trained sort of peers, lance corporals, senior NCOs, about 73 in total, so that they would then deliver some sexual health education programme to other people in that unit, rather than doctors delivering it or nurses delivering it. And what we showed was that over the pilot project, that it did actually raise awareness amongst these recruits in terms of their knowledge about sexual health issues.
I mean, one of the other interesting things that Colonel Ross said was, he said 150 years ago, STIs were so problematic that they may put the equivalent of a whole regiment out of action.
Wow.
So, of course, nowadays that's not the case, thanks to better awareness, better diagnosis and better treatments.
Talking about awareness and the old days, we've dug out a little piece of information, a little clip of the way they used to raise awareness a few years ago. Let's have a look at it.
Having a good time can bring its hazards. But seafarers are no fools. They generally manage to keep their noses clean.
Can I have some condoms?
Hello there. There you are. There you go.
Cheers.
Okay.
Let's have a decent restaurant so I can get some beers inside and find a woman, mate.
Nowadays, there's a new and deadly danger for the unwary.
And that's not Ross Kemp they were talking about there. Tell us a bit about how the myths have changed and sort of dispel some of them for us.
Well, I mean, the reality is that you can't tell just by looking at somebody whether they may have a sexually transmitted infection or not. The other thing is, just because you don't have symptoms, if you have put yourself at risk by having sex with somebody without using a condom and practicing safer sex, again, you may well have an infection, because a lot of the infections don't always cause symptoms, particularly chlamydia. And another of the myths is that you can't catch an STI if you're having sex for the very first time. The reality is you can. And another thing to be aware of is, of course, condoms are the most effective way of preventing and avoiding an STI if you're having sex with somebody, and there are now a wide range, something to suit everybody.
If you don't necessarily have any symptoms, when should you actually go and get yourself checked?
I think it's important that if you've had unprotected sex with somebody, then you've put yourself at risk, so you should get yourself checked. I think one of the things we're seeing now, which is very positive, is that couples establishing a relationship are coming to a clinic together, both getting screened, so that they know that they're going to be clear of infections in the future, which helps actually develop the relationship.
And just remind us, as if we need it, why it's important to take this very seriously.
Well, I mean, chlamydia, untreated, harms a woman's fertility. Somebody who contracts HIV can develop into AIDS, and we know that AIDS is a killer.
All right, Dr Rob, great to see you. Thank you very much for coming in.